Good evening, everybody. First of all, I'd like to welcome you for coming this evening. I'm Beverly Hank. I'm the director at Friends for Mental Health. This evening is being hosted by Friends for Mental Health. We help and support families and friends who have a relative or friend with a mental illness. This presentation is part of the type of support that we furnish. I was fortunate enough to meet Donald Bidd on the tennis courts in Dorval this last summer. It didn't take us long to put two and two together and figure, oh my goodness, what he does and what we need, there seems to be a little bit of a match there. And so we worked together, and he'll tell you a little bit more about that. Donald Bidd is a professionally trained life coach and himself a parent of an adult son having a complex neurological disease, major behavioral challenges, and intellectual disability. Donald advises and supports parents of children having complex disabilities or illnesses through facilitation of support groups, coaching, advocacy, and future planning. This evening, he will deal with the topic of future planning for caregivers of a loved one having a mental illness by presenting a number of safety and security factors which can help caregivers think about important issues in this area. I just want to remind you, could you all be sure that your phones are off so that the presentation is not interrupted? And if you have questions, either jot them down and wait till the end, and then you'll have an opportunity to ask Donald your questions. Have a pleasant evening. I'll turn you over to Donald. Thank you.
Good evening, everyone. Welcome here, and I look forward to this chance to present some interesting material to you and also to have a dialogue with you after. As Beverly mentioned, my topic is future planning considerations for caregivers of persons having a mental illness. The main points I'll be covering, I'll give you something on my own background, the big concern of caregivers, the objective of the type of work I do, to give you context, and the substance will be looking at the future planning framework of safety and security factors, and we'll spend a bit of time going through that. My background, a professional and personal coach. I'm a father of a 30-year-old son who has a neurological disease and intellectual disability. For many years, I've been coordinating support groups for parents and have taken up coaching parents, particularly in the area of future planning, and serving in a role as advocate and facilitator. My educational background or training is in coaching, leadership, strategic planning, group facilitation. In fact, in my previous careers in federal public service and private sector, I did a lot of planning, and I found that a planning approach is entirely appropriate to the kind of challenge being faced by caregivers and parents. The objective of what my work is to assist caregivers. Caregivers I'm using here in a broad way, parents, siblings, and so on, even friends that are involved. Assist caregivers in future planning that will contribute to improved safety and security for loved ones who have complex lifelong disabilities. Future planning I describe as putting into place a set of financial, legal, relationship, advocacy, and knowledge sharing mechanisms that contribute to the support and protection of a vulnerable person. I mentioned that I have a son who is 30 years old. His name is Justin. Just a word on him because he's brought me to this point of wanting to do this kind of work and engage with the caregivers in this way. He's now 30 years old, and he has a complex neurological disease called tuberous sclerosis, which manifests itself in intellectual disability, epilepsy, and major behavioral vulnerabilities to challenging behaviors. He now lives in a residence in a group home outside of Montreal. a very good one, an excellent one. And he sees us every weekend or most weekends, and he's doing very well. But I think, as any of you who are in a caregiving mode, it's been a long journey, or it's been a journey with lots of ups and downs, lots of challenges, lots of joys. And I can say that he's come through quite well. He's now enjoying his residence where he is and enjoying a range of different activities, which we at the beginning never would have been thought possible. The big questions of caregivers, and this is really the heart of the topic, and it's a question which is often on our minds or deep in our hearts, sometimes at the forefront, sometimes at the background, and it has to do with the questions such as what will happen to my loved one when I'm older, sick, have died, no longer in a position to be actively involved in care, monitoring. What can I do to contribute to my loved one's well-being into the future? And who will be there to monitor my loved one's safety and security, advocate for him or her? A few important points just before we start is that I am coming from the experience as a parent with a son with intellectual disability, and all of my work, or most of it, has primarily been in that milieu, although I've worked with a few families having a loved one with a mental illness. But by and large, the bulk of my experience has come out of the reality of a loved one with an intellectual disability. And after reviewing the model I've developed, the approach on future planning with Beverly, it was clear to me that a lot of the elements, if not most of the elements, can apply in the domain of mental illness. But nonetheless, there are significant differences. And I just wanted to signal that to you, that I think that there's a lot here which applies, but there are also different realities which will make it significantly different in some respects. Nonetheless, I think that the advantage of this kind of model is to signal to you a way of thinking or approach to looking at certain issues, and I think that's a good thing. Any particular human situation is very specific, very complex, and so this is a kind of a generalized model which signals a number of factors to look at. But I always say, even if there's one or two or three things that caregivers or parents take away from something like this and are able to work at it, it's a step ahead for the benefit of our loved ones. Future planning, another note of importance, is there's no quick and easy solution. We are dealing with a complex reality. That's a fact. You as caregivers are the first ones to realize the complexity of this reality. So future planning is a process, and it's not a process that will take a few days, weeks, months. It'll take a few years. There's a lot of different angles to future planning and implementing a future plan. So I invite you to look on it as a process which takes time, reflection, the input of others. And in that respect, the input of others, future planning really requires the input of a wide range of professionals. I'm going to be pointing to the role and input of other professionals in this presentation. Financial planners, notaries, lawyers, insurance specialists, social worker, accountant, government agencies that specialize in certain areas. So these are resources that one must need to turn to, and I will be making important pointers for you to follow up in certain areas with these specialists. That difficult and challenging question, what about our loved one into the future, especially into a future when we're no longer actively or can be involved? Well, what's the answer to the question? I believe the only real substantive answer is, in some respect, to take a planning approach. To say, well, this is a challenging situation. There are factors we can control and there are factors we can't control. But in looking at what we could possibly have influence over or control, can we take a planning approach by identifying factors and looking at them and putting into place certain mechanisms? They can deal with financial security and planning, will and trust, legal protection mechanisms for the vulnerable person, a facilitated network of supportive friends, sharing of knowledge about the loved one with trusted others, and advocacy into the future. I've developed this framework of safety and security factors based on the input of some other leading organizations that have done work in this area. So this comes from a base of research. And I'll describe what are the factors here in a general sense, and then we'll go through them, or most of them, in a bit more detail in the next hour or so. And some of them will not be able to enter into too much detail, but at least we'll give you an overview here. A safe and secure future for a loved one who has a significant, either enduring or lifelong disability, is made up of several different factors. And this is what this framework tries to present. At the very top, what you see here is your vision and hope for a good life for your loved one. That's why we're here. That's why we're concerned about this topic. We hold in our hearts deep hopes for a good life for our loved one. And that's what impels us to want to take a planning approach and address certain factors that we're capable of addressing. So vision is the kind of the bedrock there. And then looking from the left to the right of the screen, we have a set of factors here, legal, financial factors. These can be questions of wills and trusts, powers of attorney, mandates. Then we have something relating to the vulnerable person, him or herself, protection measures. These can be legal or these can be non-legal too. And then this whole area of finances, financial security. Certainly a degree of financial resources is part of a good life for any person. And what are some of the planning elements that can be looked at in thinking about this aspect of safety and security? But these are legal, financial, and they're very important. But there's also the factor of relationships in the community and friendships. A safe and secure future for any person, even for the present of any person, often resides in the nature and quality of relationships and support that the person has. And I'll explore this in more detail as we come to it, but this can be something such as involvement in the community, going to more deeper levels and more personalized levels of a circle of support for the person having a disability. We'll explain how these elements work and why they're so important in a few minutes. Another category of safety and security factors, both in the present but also looking into the future, are the kinds of services our loved one will need into the future. There's different kinds of services. The most significant one that often comes up in discussion, and I alluded to it in the beginning, was a home, a residence. At a certain point, we were no longer able to have our son at home because of the many challenges he had. So when he was in his late teens, we needed to obtain the services of what we call a group home or a resource where he could be cared for, and that's an important component when we think of his future in terms of his stability and care and well-being. There's also other things such as day programs, therapies, skills training. and the whole area of advocacy and lobbying that ensures that these services can be there. A couple of other elements which deal actually with future planning are caregivers themselves taking care of themselves and their couplehood and other siblings, the ability to have self-care and couple care, such as the kinds of services offered through the Friends of Mental Health, are important in terms of thinking about the future of our loved one, because it's important that caregivers take care of themselves, to be more present into the future as much as they can be. And then I'll touch upon at the end about knowledge sharing and documentation on the loved one. So let's get into the substance of some of these safety and security factors. Again, as you work through this, you will see some will apply, some may not apply. You may wish just to take a note on those that seem to be of more significance to you in terms of possible follow-up and possible action. I mentioned earlier at the beginning the importance of a vision. When I work with a family, we have a kind of a questionnaire, a set of questions that we can discuss, and they relate to helping to articulate and bring to mind and document what the caregivers want and hope for in the future of their loved one. Some of the questions that we deal with are, what dreams do you have for your relative? What future for your loved one makes your heart sing? Sometimes it's difficult for caregivers and parents that I work with to enter into this. These are challenging questions because the demands of the current moment, the current challenges, sometimes crises, are overwhelming. But there needs to be a right time and space to look at these questions and give voice to them. Some of the questions are difficult from an emotional perspective, but they do allow caregivers to enter into this and to face the kind of questions that do allow them to articulate their hopes for the future, such as, it's the day after your death. Describe what a safe and secure life will look like for your loved one. It could be, as in the case of my son, a competent and compassionate caregiver, that is not myself, but another resource who will understand my son fully, be patient and respectful, a strong circle of support, of caring family members and friends, regular contact, fulfilling and meaningful activities, such as day program, outings, weekend activities, quality medical care because of in his case, several medical complex issues, and consistent monitoring and follow-ups. And through this exercise, through these questions of working with caregivers, it's really quite astounding. We're able to help parents and caregivers work through these. Important words to describe a typical day for your loved one in the best of all possible worlds, or your concerns or even your fears about your loved one after you're gone. And what's the most important message you want to leave your loved one? What do you want survivors to help with after you're gone? When executors or trustees meet, what do you want them to do first? What are the 3 priorities you want future caregivers and members of a circle of support to remember about your loved one? And this question, what are the most important arrangements you've made to ensure a good life for your loved one into the future? Going into a bit more depth on this question, this could be, for example, arrangements, updating a will, setting up a trust, choosing appropriate trustees, creating for ourselves as caregivers a power of attorney and mandate, establishing with the collaboration of the loved one, ideally appropriate legal protection mechanisms as feasible. If the person is eligible, creating and contributing to a registered disability savings plan, developing a circle of support around the loved one, and creating an in-depth information guide. See, these are some of the key objectives and arrangements that have come out in the work that I've been doing with parents, caregivers. Through the use of these planning questions, it's important to have good, open family conversations with family members about the future of the loved one, and in the right time and the right space to implicate and involve the loved one as appropriate. Let's look at the specific factors moving from left to right here. I'll deal with the category of legal and financial factors, will, protection measures, financial plan. I'll start off by looking at financial planning and security, issues such as the disability tax credit, RDSP, life insurance, financial planning. Again, I'm going to point you towards a financial planner, particularly one that has expertise or sensitivity to disability issues. So that's one kind of professional right away I'm pointing you towards as part of this. That is not my expertise, but I do know that this is a key element that must be integrated in a future plan. Then we'll touch upon some aspects about wills, powers of attorney, mandates, then legal protection mechanisms for the vulnerable person, him or herself. Let's look at financial factors. Key elements here that have come out of the planning that I've done with caregivers is the need for a comprehensive financial plan for the caregivers themselves. Many caregivers are older, advancing in age, and they themselves need to update their own financial plan so that provisions are made for their own care, their own planning into the future. This is very important. Along with that, one can work at a financial plan for the loved one. What could be his or her needs into the future? And this can be an exercise of looking at all their various needs and interests and linking that to the vision so that one can imagine and associate financial resources to those various needs and interests and skills and that the person has. I mentioned the need for implicating a financial advisor with competency in disability issues. I'll touch upon a disability tax credit, the registered disability savings plan, the importance of maximizing income tax deductions and benefits, and certain life insurance considerations. Again, I'll only be briefly touching upon these topics. Several of them can merit a seminar of themselves, and there do exist such seminars, and I'll be pointing you towards these resources. I'll talk about the disability tax credit, because that's kind of a key nuts and bolts element. Just as an example of another resource, this is an example comes from Canada Revenue Agency, where they have an excellent series of video tutorials on tax measures for persons with disabilities. And so I invite you to look at resources, and as part of your future planning, there's a self-education process to familiarize yourself with several of these concepts. But if we look at one of the key elements of financial security, but also related to disability, is we have what is called the Federal Disability Tax Credit. Some of you may be familiar with this. Some of you may be your loved one who has a mental illness considered as a disability may have this already in place. But I've encountered quite a few parents that are not aware of this, so it's an important thing for caregivers to be aware of for their loved one. Basically, the federal disability tax credit is a tax credit at the federal level for a person with a severe and prolonged impairment in physical or mental functions, and that person becomes eligible for this DTC, tax credit. The very important point I want to make here is that the DTC receiving that disability tax credit, being approved for it, establishes eligibility for the very important thing called the Registered Disability Savings Plan. But a few more words on the disability tax credit. It reduces the tax for a person with a disability, can be transferred to a caregiver or supporting family member, especially if the person who has an illness considered as a disability cannot, because of their lower income level, cannot take advantage of the tax credit. It can be transferred to caregivers, and it's quite a range of caregivers that can, family members and relationships that can be supported, can benefit from that credit. Interestingly, it can be claimed retroactively for 10 years. That's very, very important provision. It's for prolonged physical or mental impairment, and I believe the legislation describes it as lasting at least a year. It could also apply to an illness or disability that lasts over a period of years, several, 5, 10, but then is no longer in place because the person has gotten better. But as long as the person is in a state of illness and disability, the tax credit applies for that period. And if we're talking about the area of mental illness, if we look at the language of the disability tax credit, it talks about mental function restrictions, impact of the illness on goal setting, memory, judgment, self-care, and following instructions. This 3-page form basically needs to be filled out by the medical practitioner. And it's very important that the medical practitioner be able to describe the impact of the illness on the functions of daily living. This greatly increases the chances of it being approved, because if it's well described and well documented, and I work with parents on that to ensure that best chance is given in the documentation done by the practitioner. So the federal disability tax credit is kind of a key element. And then why is it so important? In one respect, it's very important because it really establishes eligibility for what we call the Registered Disability Savings Plan. I think that's a statistic shows that a large number of Canadians with having disabilities are not aware of the RDSP. It's not heavily promoted, but it's an absolutely key thing for persons who have a prolonged mental illness, which is then considered a disability, and their caregivers to consider applying for this to ensure that this important financial resource is provided, made available to the person. And basically what it is, it's a long-term savings plan to help Canadians with disabilities and their families save for the future. It's made up of 2 components. One is called the bond, and each year for a period of 20 years, the person having a disability receives $1,000 per year, up to the maximum of $20,000. And then there's another component of the plan, which is called the grant. And what that means is that there's a matching, in fact, an overmatching by the federal government of contributions that are made to the plan. For example, my son has such a plan. He is the beneficiary of it, and in his case, I'm the plan holder. The beneficiary the person having a disability could also apply for and manage their own RDSP. But in the case of my son, he doesn't have that ability to manage his finances. So as his parent, I'm entitled to be the plan holder, and he is the beneficiary. And so contributions that I make to his plan call forth from the government matching grants. So for example, a caregiver that contributes $1,500 a year to the plan, the government will give $3,500 that year as an overmatching grant. And that $3,500 per year comes to a total amount of $70,000. So in effect, what I'm pointing out to here is that the grant and the bond result in a government benefits of around $90,000 for a person that has received and continues to receive the disability tax credit, the earlier tax credit I mentioned. So I encourage you to look at the websites that I provided here. The Plan Institute, which was the parent-run organization in BC that was at the origins. It was their lobbying, their advocacy, and their visionary work. It's a parent-run organization in British Columbia. It was their work that allowed the RDSP to come into play as a government policy. So as a community, we're very indebted to the visionary work that those parents engaged in to allow the RDSP to become the key thing that it is. So you see there's a website and a toll-free number with an excellent advice, calculators, guides, and the key federal government sites from the government department that manages this program and the Canada Revenue Agency, and of course your financial advisor. There's a certain, believe all chartered banks and a number of other financial institutions are credited to be able to provide RDSP services. You'll find all that information on these various websites. So just to situate ourselves, financial planning and security, the disability tax credit and the RDSP are key components of that financial aspect. At the same time, I encourage you as caregivers to look at the whole area of other disability-related credits. I've talked with, and I've had the experience by myself of not benefiting from certain credits just because of the seeming complexity of these various credits in the area of disability. And I know quite a few parents that have not maximize their various disability-related credits. Apart from the disability tax credit, there's other ones here listed. And again, the federal CRA site has great video explanations of these. And of course, working with your accountant and requesting that your accountant look into these credits in depth to ensure that your loved one, or if your loved one can't benefit from the credit because of their lower income, if that's the situation, then caregivers can benefit from those credits, different credits that are listed here. Quebec has a very useful publication called Tax Benefits and Persons with Disabilities, which is very good. There may be an updated version. I didn't check, but I think this may still be in effect, but this merits being looked at too. So we talked about the financial planning and security. I'd like to talk here about some legal aspects or legal dimensions of future planning. And here we're going to talk about the question of a will for the caregiver with consideration of a discretionary trust for the loved one, power of attorney for the caregivers, and mandates for the caregivers in case of incapacity. After that, we'll look at various protection measures under point 4 that could apply to the person having an illness or disability. The key point here I want to make is that it's very important for caregivers, for ourselves as caregivers, to make sure that we have updated wills. And statistics have shown that a large percentage of Canadians either do not have a will or do not have an updated will. I was working more recently, and one of the parents that I'm working with, they were very confident of their will, and but it's been 10 years out of date. And when we discussed this and looked at the issues, it was very clear that certain provisions were no longer accurate. So it's very important for the caregiver themselves to have an updated will with consideration of a discretionary trust for the loved one having a disability. I'll talk to that in the next slide. But it's also important, apart from the will, and we talk to bullet number 2 here, for the caregiver themselves to have a power of attorney designating another person, a mandatory, to represent him or her and act on his or her behalf in legal transactions. We'll call it, and that's basically called power of attorney. But there's also an incapacity mandate, which allows you as a caregiver, while still of sound mind, to designate a person to see to your welfare and affairs if you become unable to do so because of illness, an accident, or an impairment. These are very, very important things to think through yourself as caregivers, yourselves as couples in those situations, or as families, as to who will exercise your legal responsibilities should something happen to yourself. Often the focus, and rightly so, is on the loved one who has an illness and disability, but this is part of the picture. It's part of the planning, and I strongly encourage all of you to look at that question. There's some great resources on the Service Québec website on power of attorney, mandate, and the Ministère de la Justice website, simply by Googling those. And these are key elements in terms of future planning. A lot will come out of the discussions with the notary or the lawyer when you're going to sit down and update or do these documents. As part of the will planning process, it's important to consider the possible use of what is called a discretionary trust for any resources left to a loved one with a disability. Basically, if I can use my example of my family, my son who has a disability, I'm not able to, and I wouldn't leave him resources directly to manage himself because he doesn't have that ability for financial management. So what the parent or the caregiver does is create a trust for the loved one, which is a legal instrument within a will, whereby resources are left to that trust meant to be used for the benefit of the loved one. And it's trustees that are designated to manage that trust money on behalf, as it were, for the benefit of the loved one having an illness or disability. And the role of the trustees is to ensure that the resources in the trust are spent wisely to support the loved one's needs. A key aspect about a trust, of course, is that that money given to a person, to a loved one that comes from a trust that is allocated for their needs, is not considered as income for social assistance by the social assistance. So up to a certain amount per month does not affect social assistance, or call into question social assistance payments. So there's an important point there is that it's basically essential to consult closely with your notary or lawyer, ideally someone with some experience or sensitivity to disability situations and the use of discretionary trusts, as to how this instrument can be part of the future plan for your loved one. And caregivers share their vision. I talked earlier in the presentation about the vision, and that's important because it allows caregivers to document and to share their vision into the future with the persons who will be trustees. Trustees can be, there's usually, well, the law requires 3 trustees. They can be family members, trusted friends, professionals. There's also an option to use a trust company. And there's these things can be looked at, the pros and cons, with a notary or lawyer. Also, a discretionary trust has a better tax status. It's the monies from a trust have a lower taxation rate than money left directly. Again, I point you towards the professionals in this area, but it's certainly one key factor that is coming out in my work with caregivers. Oh, I just wanted to mention, as part of the financial planning, step back into that for a second, is that it's important to look at life insurance considerations. Sometimes life insurance proceeds can be seen as a source of support that are left for the loved one. And again, I invite you to evaluate these options and strategies with a life insurance agent and your financial planner. You know, the question of permanent versus term policies, joint and last to die. I've met quite a few parents that are looking at joint and last to die policies, and insured annuities. Again, this is a specialty area, but it's one part of the learning process as you advance and you're thinking about what would be the source of resources left to a loved one at death. I want to talk about one other aspect of the legal dimension, which relates to the loved one, him or herself. And that is the area of what the Office of the Public Curator calls protection measures. To what extent, to what degree does the loved one require protection in terms of their vulnerability, in terms of their ability to manage financial assets, to make decisions? This is a complex area, and it's very dependent upon individual circumstances, the capabilities, ability to consent, the capacities of an individual person. And again, I invite you to look at an excellent resource in terms of education for yourself at the Office of the Public Curator, which has several pages there which outline the various types of protection measures, both legal and non-legal. So under family support, what this means is that a person having an illness or a disability could very well have the necessary level of protection through the efforts of a family that help the person to manage their finances. That's what that means. There's no legality involved there. And then there's other mechanisms which are non-legal, which are more in the area of administrative, which deal with standard protection, power of representation, domestic mandate, power of attorney, administration by a third party. And then there's another category called legal protection measures. And this is where there is a legal process whereby someone is designated to represent the loved one legally, to manage his financial interests. And even within that, there's different categories. protective supervision with an advisor, tutorship and curatorship. And these are meant to reflect the varying levels of capabilities that a person might have. For example, in my case, in the case of intellectual disability, this is more often the case. I am the curator for my son, Justin, which means I have the most, as it were, legal powers to protect his interests, because certainly in his case, he has no capability to carry out, protect his financial interests, manage them, or make decisions in terms of the residence he might be in. But every person is unique, and in the area of mental illness, there will be a lot of different particularities because of the capabilities of the person. But again, in the perspective of pointing you towards a resource here and other professionals, the social worker can be a key aid if you have a social worker in the picture of your family situation or your loved one. The Office of the Public Curator of Quebec has very good bilingual resources on this. And of course, a person on social assistance benefits from legal aid, and one can get free legal aid services, perspective of a lawyer to look at these various options. So it is a complex area, but it can be well understood with time and with the right input of professionals in terms of what are the types of protection measures that are feasible for a loved one with a vulnerability in terms of decision-making and financial management and other protection measures. I'm leaving the area of legal financial to talk a bit now about the area of relationships in the community and friendships. You know, a safe and secure future for our loved one is a function of certain legal, financial resources and so on, certain legal factors of protection. But a safe and secure future is also a function of how they are supported in human relationships. I was talking to an executive director of a mental health, community-based mental health services organization. And he talked about one of the most significant problems is isolation and the need for relationships, community-based relationships and friendships as a key element in a good life for a person having a mental illness. And that's certainly the case in the area of intellectual disability too. So a good predictor or a good factor in a safe and secure future for a person with a lifelong disability such as mental illness are supportive relationships. And these can be at different levels, as you see in this middle column. Being inserted in a community, being involved in a community, having a more deeply caring community, and even, as we'll talk about in a bit more depth, a circle of support. So that's the key point I wanted to make was relationships, friendship, support are strong factors that support safety and security into the future. And I think as a parent, and as you as caregivers, I think that we could probably all agree with there's nothing more we would like to see into the future of our loved one than them having a circle, having a set of supportive relationships around them. That's something that money can't buy. Safety and security in the area of support and relationships has different dimensions. In point 5, I mentioned general community involvement. This is just being part of a community, attending some events, just a chance to possibly meet people. And then it goes a little bit deeper. There's some opportunities to be in part of a caring community where the loved one and the relatives can be part of a community where the person comes to be known and loved through regular gatherings. These can be parent support groups or support groups for the loved one. Often church groups play a big factor in this, parent associations. This is where the relationships are further developed. And then this can lead to point 7 here, which is a circle of support of friends and family members for your loved one. And I'd like to spend just a bit of time, a few minutes on this, because this is a key element and is something emerging in the area of disability. And there's been some very important successes in this area. I'd like to signal to you what this might mean for the future of your loved one. I mentioned before a caring and loving community where the loved one comes to be known and loved. In the case of my son, these are a parent support group and families, and we meet for a monthly potluck. And this is, it's a place where we can invite others to come and meet our son. A safe place where people can gather in friendship and come to know each other a bit more. I'd like to talk about the notion of the facilitated circle of support, keeping the loved one connected to a caring community. This is an innovative concept. And again, I must credit here the organization I referred to earlier called PLAN in BC, Planned Lifetime Advocacy Networks. It was at the origin of this in Canada, the concept of a facilitated circle of support. And it was 2 parents, mother and father, with a daughter with having Down syndrome. And it came out of all of their research and thinking about the good life, a good life for their daughter. And basically, some of their key insights were that a person with a disability, with a significant illness, every person needs relationships. Every person, no disability precludes relationships. And relationships are possible. Friendships are possible. And what they realize, though, is that it's not an automatic process. The kinds of skill sets that we have to create a circle of support around us are not necessarily, in most cases, the kinds of skill sets that a person having an intellectual disability and perhaps in many cases having a significant mental illness might not have that complete set of skills that we often take for granted. And so this couple founded an organization called PLAN, and they developed a whole method and approach for developing circles of support around persons with vulnerabilities, with illnesses and disabilities. And what this basically means is that work is done to create around the focus person, in this case my son Justin, the person at the center, to build for that person a set of friendships and relationships. Because my son can't do it by himself. So how do we, what kind of help does he need to make that happen? And so one of their key discoveries, and you see it listed on the right-hand side of the screen, is that for the focus person, for the person with having a disability, a skilled facilitator is hired. Yes, the person is hired for that set of skills. And the role of this facilitator is to build a network of friendships for the person at the center. By reaching out to potential family members or friends, introducing the person to those potential friends, and nurturing and facilitating the development of those relationships. And they've succeeded. Plan has succeeded over the years, and now they have chapters across the country where this is being done in quite a few different cities. And so the notion of facilitated circle of support is very important, I think, in terms of a potential concrete investment that can be made in the future of our family members having disabilities. How does it work? Friends and family members are invited to be part of an intentional circle of support. Each friend has a periodic activity with the loved one based on a common interest. And the whole focus in this process is on the gifts, on the abilities of the loved one, on their interests, on their many skills. It's not on limitations. So it's really attempting and succeeding in creating bonds based on shared interest and affection. And then this circle has regular gatherings to create bonds amongst the circle of support. Can be at the home of the loved one, outings to restaurants, leisure activities. And Plan now has over about 15 to 20 years of work now, has put into place well over 80 well-functioning, developed support networks like this. And again, I mentioned there were groups like these across Canada, in various cities. The facilitator is hired, whose job is to come to know the person in depth, spends around 6 to 8 hours a month, especially at the beginning, to get to know the focused person, the loved one, monitor his or her well-being and quality of life, reach out to friends in the community based on the gifts and interests of the person. Facilitator provides support. They're kind of a bridge to relationships, as it were. And the facilitator also coordinates that network gathering every couple of months and brings in new friends into the circle as necessary over time. The facilitator can write up a profile of the loved one and share with potential friends. It's not easy to read, but I provided you, and you can look at it later, the profile that was written up by the facilitator of my son, which describes all his capabilities, all his interests, all the wonderful things about him. And it's not meant to say that the facilitator won't sensitize a potential friend to my son's vulnerabilities, and that will be dealt with, but the emphasis is on identifying and naming all the wonderful good qualities of the person, which can form a basis for friendship. And this is shared selectively with people that could be interested. Facilitator does this by working in the community, working leads and potential relationships that might already be just there. Just to mention that the achievements of Plan are significant, and I will invite you to look at the website of Plan. I'll provide that at the end. They have excellent resources, books, videos that describe the notion of the circle of support. And the key elements are that no disability precludes relationships, friendships are founded on shared interests, and caregivers themselves, parents, often have difficulty in asking others to be involved in the life of their loved one. And so this is the role and the logic of a skilled and welcoming facilitator. I think that also, if we connect the role of the facilitator with some of the earlier elements I mentioned about RDSP, financial resources, discretionary trust, I know it's my intention, I know it's the intention of many parents or the parents that are involved in creating these networks, that we will leave instructions to our trustees that our son's financial resources, or a portion of them, be used to maintain their circle of support through the ongoing hiring of a facilitator. I think it's a very customized, very respectful, and very effective approach to future planning, which puts an emphasis that there will be caring people into the future for our loved one. And that, for example, in my case, I have another son who I anticipate will be the curator for his brother. And it's important that the other family member who could have a lead role into the future also feel that there are, and see that there are other people involved in support and in relationship with the loved one. And I think really Plan's accomplishment was brilliant in terms of seeing that these relationships will not happen automatically. It's the role of searching them out, introducing them to the loved one, dealing with challenges, and just persisting in believing that the person with a disability is fully capable of enjoying friendship over time. I'm heading towards the end here, but I'll deal with the category of services. We've dealt with legal and financial factors, relationships, and services are part of the future of a safe and secure future for our loved one. And there's a whole range of services which might be at play, but one of the more significant ones is an appropriate and supported housing, residence. I know that there are all different types of these depending on the needs and capabilities of the person. But I will signal one important point, and that's the key word that you see here, advocacy and lobbying. We can imagine that into the future of our loved one, it'll be important to have the role of an advocate, someone who will develop a good working relationship with service providers, government organizations, someone who can avoid anger, confrontation, and suspicion, and see the service provider as a partner, not as an opponent, being assertive and respectful, focusing on results and seeking a solution, if necessary, going higher in the organization, and calling forth support from resources like a community mental health organizations or a social worker. So I think as part of the future planning for your loved one, it's important to consider the role of the advocate. Will this be a sibling? Will this be another role that the facilitator, I talked earlier about the facilitator, several facilitators can also play that role of advocate. When there's a need for a different type of housing, or there's a waiting list, or there's any number of challenges in dealing, quote, with the system. So that role of advocacy is a key consideration as part of this future planning process. Ahead to this last category is knowledge sharing and documentation on the loved one. What I've found in working with parents and with caregivers in this milieu is that a lot of the information, a lot of the expertise and knowledge about the loved one is in the heads of the caregivers. They have an extremely rich understanding, in-depth understanding, but it can be one person or two persons. And this is really a process of making visible, or making, as it were, external, all of this knowledge that caregivers may have, or do have, about their loved one. And I work with parents, I interview them, and I get down on paper, basically, a lot of information about their loved one, and it's put into a document, confidential document, which they can share with members of the network, with other key family members, with close friends, but it ensures that the in-depth knowledge about the person just doesn't reside within the head of the caregiver. For example, if I look at the table of contents of the complete guide to Justin that I've written, well, it has everything you needed to know about my son and more, from the model of care, finances, benefits, services, his private curatorship, how does that work? What are the obligations? What are his character, interests, likes, dislikes, strengths, vulnerabilities? Very important, what are his medical and health issues? And so it's quite a job to put this document together at the first time, but once it's updated, it's done, it's easy to update. Activities of daily living, routines, and the last point he mentioned here, challenging behaviors. So that's the notion of the guide. So I've taken this time to outline to you a complex area, and just to sum up, this is the framework. And I would say that, in conclusion, future planning can contribute to your loved one's safety and security. Maybe not all of these elements can be dealt in each case, each situation, but I think it's important to at least engage in a process with the input of trusted others and professionals. And I'll refer you here to some key resources for future planning, especially the wonderful, wonderful publication by the Plan Institute called Safe and Secure, 7 Steps on the Path to a Good Life for People with Disabilities. Just an excellent resource. It'd be very inspiring for you to read this. Thank you very much.